Hello, I'm here to discuss the difference between Tickle liposuction and traditional liposuction. There are many differences, and you can decide which is best for you. In the traditional liposuction, you require general anesthesia. You need to usually be in a cold, austere environment, in an operating room setting with a lot of staff, nurses, a lot of bells and whistles, cuffs and needles. Also, the mechanism is different. This is really important. The mechanism of traditional liposuction is that you have a larger instrument called a cannula, and basically the mechanism is it just thrusts forward and back, pushing, pulling, shredding, and that's the mechanism to remove fat. You have to be under general anesthesia so you don't feel that. Unfortunately, when you wake up, that's a lot of tissue trauma that you wake up to. Now, the Tickle liposuction is a lot different. The mechanism is a nutational device where the cannula is a lot smaller. It is smaller than the size of a pencil. And the rotational, it rotates, it vibrates, and it vacuums at the same time. So this mechanism is actually much more efficient. It doesn't tear, shred, it vibrates and removes the fat at the same time. And your recovery, because these structural changes are not so large, you can recover a lot faster and see results faster. Under traditional lipo, it takes a good 3 months. Under Tickle liposuction, you start seeing good results around 3 weeks. So it's a big difference. Also, the environment, the Tickle liposuction can be done in an office because it's under local, meaning lidocaine is basically specified to that area versus general anesthesia, and as well as safety. The Tickle liposuction, because it's a smaller instrument and it does vibration, it's a lot safer. It has a built-in safety mechanism that when it reaches into deeper tissue, it stops. The tissue trigger is different. So this is a nice built-in system that the traditional liposuction does not have. Also, downtime. Tickle liposuction, I have people going back to work the next day or the following day. Under the traditional liposuction, the bruising, the swelling is quite significant for weeks to months. As well as cost effectiveness, when you're hospital-based under general anesthesia, the cost obviously will be a lot more. That's starting at $4,000 just to have a procedure. When you're in an office-based setting, you don't have all that overhead and all that cost. So it's safer, much more cost effective. You heal faster, the downtime is less, the environment is much more warmer, friendly, but yet clean and sterile. So that's the difference between Tickle liposuction and traditional.